CFBHN supports community prevention coalitions. We have them established in almost all of our communities, and what these are they're actually led by communities and people that are concerned with mental health and substance abuse issues. Today we're going to show you an example of a great prevention coalition in operation, Drug-Free Manatee.
We have a lot of students that are 18 that go to school here, and they smoke, or they dip, or they chew, or whatever. It's not illegal for them to possess tobacco, is it? Because they're 18. However, it's contraband here on campus because you can't have it here on campus. Hopefully what they really got out of it was the concept that we think before we do something, and the consequences that can follow, because they really need to understand how far the consequences reach. Not just, I did something today, I'm getting suspended today. You know, the concept that it could close doors down the road. And that's what we really need, is them to think about things.
Today I learned that no means no, and that you shouldn't be pressured to do anything, and don't feel like just because someone's telling you to do it doesn't mean it's the right thing.
I think probably just like the biggest thing that I learned is just that, you know, so many people today, they're out using drugs, they're out doing this or that, but it really does have like big consequences, and like it really can affect your life later on. Just because, you know, everyone's doing it doesn't mean that it's cool or it's the right thing to do.
Some stuff probably happened to me before, like not to do it no more because I learned it from today, so then I'm not going to do it next time.
I think one of the biggest problems we have is that you have to get the parents, and you have to get their whole support group, because you know that old saying about it takes a village to raise a child. That's absolutely true. And what we need here is for them to all recognize that we all have to take care of these kids, and that they're going to be the future leaders, and they you know, we need to bring them up right and send them down the right path.
One of our biggest campaigns, one of our initiatives, is specifically around prescription drugs. Their safe use, their safe disposal, trying to prevent diversion. We run a campaign called Secure, Monitor, Dispose, securing drugs in your home, monitoring them to make sure that you have what you're supposed to have and they're where they're supposed to be, and then disposing of them properly. The Secure, Monitor, Dispose campaign, it's primarily to create awareness around prescription drugs, how they're provided, how they're held in the household, how they're used to try and prevent diversion. But also importantly is, and if you're not using them, what are you doing with it? The deterrent system is one of the initiatives, one of the strategies that we're using to ensure safe disposal of prescription drugs. This is the bright shiny toy in the toolkit that we're finding for law enforcement or for our other agency partners. This is something that resonates with people. It's like, I don't have to go out of my way to do a good thing. It's in my house, I can take care of this, and I can feel good about what I'm doing. And we're expecting this to go statewide. It's a safety issue, it's an environmental issue, and it's a prevention issue. We're trying to keep drugs from being diverted. So it's actually covers the whole schema of things that we're trying to do in prevention.
A lot of people don't think that fire departments are involved in the drug abuse in the community and things like that. But we are actually really hands-on with what goes on in our community. Your Life Matters cards, we developed those because we saw a huge increase in drug overdoses in our community, in our county, and it's really taken off to nationwide now. And so we wanted to really have something to make a difference in our community. So we sat down with multiple agencies and we developed these cards. And it's a simple card, but that was one of the purposes behind the card, was to make it simple. When we respond to a drug overdose call, we meet these people and we get to talk to them. And a lot of times we are successful in reviving them so they come back to life. And we get to hand them these cards that give them the ability to, when they wake up, when they go to the hospital, they have a chance to pull it out of their pockets and look at it, and they see the Your Life Matters on the front, and on the back they see different drug abuse agencies to get some help with. Central Florida Behavioral Health Network has been a huge agency behind the backing of these cards. They've funded a lot of this, along with multiple agencies, and they've been a huge help in putting together a lot of the content of these cards, along with Drug-Free Manatee. It's been a really collaboration of multiple agencies together, and it's been a huge help. And we've seen a decrease in drug overdoses, but at the same time we've seen an increase in patients visiting substance abuse help centers. And so what's happened is we've noticed that these cards are getting into the hands of these addicts, and these places are filling up. So there are people seeking help.
We have produced a lot of results, but it's collaborative. It's not Drug-Free Manatee. They're a part of it, but a coalition brings people from different sectors together to work together to address safety and health and wellness in the community. And I think we've done that, and we continue to do that.
We've seen what can be done in a matter of 12 months, and I think the statistical numbers speak for themselves. The word that was used by Sharon Kramer was diminished. We've seen overdoses come down, we've seen fatalities come down. So in law enforcement, we cannot arrest our way out of this problem. We know that. That's not our objective. So by working together collaboratively, we've seen results, and I think the results speak for themselves.
Well, so far, with just the results of what we've been doing so far with the task force and all the community partners, and law enforcement's a huge part of that, we've seen about a 50% decrease of people coming in testing positive for heroin. We are also do a lot of prevention throughout the community and in the schools, so that also helps. We have great partnerships in all those places, and everybody's very open to whatever is there to educate the community and to let them know what we can do to help this and help people that obviously have a disease of addiction.
Over the last year, we've probably had 800% reduction on that crisis, the heroin, people overdosing on heroin. And we've worked with a lot of partners to make that happen.
CHIP, the Community Health Improvement Plan, was a community partnership. It establishes ownership for everyone within the community, and we hope that we can pool our resources together to address the issues of substance abuse, overdose, co-concurring behavioral disorders. We feel like by we all working together, we can definitely address these issues.
We're working together with Drug-Free Manatee to bring some broad-based programs in, specifically to work with our 9th grade students so that they are given some information. And we are trying to support whatever we can to make sure that those students have enough information because there's such a big change when you move from middle school to high school. I'm always ready to be optimistic about students and what they need to be prepared for. So I'm very optimistic that we'll be successful with this because we have in the past.
We have a process called a Strategic Prevention Framework, which is just a planning process to look at what is the problem and what are the local conditions, why is that a problem here? You know, it may not be the same problem another county is dealing with, but we look at that and we work together collaboratively on that. So I'm very proud. I'm proud of the collaborative spirit in this county.
Behavioral health is essential to overall health. We believe and we know that prevention works, treatment works, and people do recover.